Good day. I'm Hyla Kluyts. I'm a specialist anaesthesiologist based in Ga near Pretoria in the Gauteng province in South Africa. Thank you for the opportunity to talk on Choosing Wisely Africa in this session on Choosing Wisely Reducing Interventions of Low Value in Anesthesia and Perioperative Medicine. I have to admit that I am somewhat of an imposter. I have not contributed previously in any way on the topic under discussion. However, I accepted the invitation to speak because it presented an opportunity to represent the clinical perioperative community in Africa who are finding a voice in the African Perioperative Research Group, or APOC. Under the guidance of Bruce Bickard, APOC has evolved during the execution of a number of projects under the African Surgical Outcomes Study brand. I'm also the founder and director of Safe Surgery SA, the non-profit company that provided research support to these projects and administers the African Perioperative Research Group. With this background and some limited insight, I've decided to attempt at addressing these two learning objectives of the session: to discuss determinants of success and failure in translating the recommendations, choosing wisely recommendations into practice, and to explore the need for clinical research and health policy research to underpin the recommendations. So the key points are that, to our knowledge, no widely implemented choosing wisely recommendations for Africa exist, and there is also limited capacity to develop guidelines in Africa. And lastly, that the relevance and the feasibility of implementation for choosing wisely recommendations in Africa are open for discussion. So as the cost of healthcare increases, it is becoming more important to demonstrate value. And to demonstrate value, we need the quality of care has to justify the cost of care. So improving the effectiveness of perioperative care by appropriate allocation of resources may reduce costs. But that is of particular importance in the under-resourced environment of the African continent. And this map indicates the country income classification of African countries, with the majority of countries being either of a low income category or a low middle income category. So in addition to country income classification, it may be important to interpret clinical outcomes data or effectiveness of healthcare interventions in the context of other economic indicators. And of particular interest to me as a South African are indicators of inequality, such as the Gini coefficient or index, which is a measure of frequency distribution of, for example, income values in a population. So a country with a Gini coefficient of 1 or an index of 100 shows maximal inequality. And this map indicates that South Africa is the only country in the world with a Gini index of more than 60. And that for a number of sub-Saharan African countries, the Gini index is on the higher side. So this paper illustrates the impact inequality may have on health in outcomes. And the authors analyzed data from 3 cardiovascular trials by including country income classifications and inequality index for the cases under investigation. And the study shows that living in countries with a low and unequally distributed wealth had a stronger association with death rate than any single comorbid condition. So despite the pressing need to understand drivers for cost of healthcare in low and middle income countries in Africa and the cost effectiveness of perioperative care, economic considerations are limited to health system impact in the research priorities set by the African Perioperative Research Group in a Delphi consensus study. So with this background, we decided to embark on a study to assess the need for setting choosing wisely recommendations in the African context. And we did this by interviewing a group of African leaders, and this will follow with a survey to APOC anesthesia members. So the interview structure is broadly based on three aspects. Firstly, awareness of choosing wisely recommendations, the principles of the initiative, and some individual recommendations from the US and UK, specifically on anesthesia, chronic non-cancer pain management, and critical care. Then also the necessity of relevance for an African initiative, and if it is necessary, should we adapt existing recommendations or develop new recommendations, and whether these development of choosing wisely should take priority over development of other guidelines. And then lastly, the feasibility of implementing African recommendations and the potential impact it may have. And preliminary findings were that most participants were not aware of what choosing wisely entailed, but in principle agreed that recommendations to limit overuse or unnecessary use of resources is very necessary, and that most clinicians do not pay much attention to efficiency of care, let alone cost efficiency. And there was also a feeling, that social structures may not be sophisticated enough for recommendations to be patient-orientated. And shared decision-making is still largely a theoretical concept in most settings in Africa. The individual recommendations that participants thought were of most value were those on preoperative testing and blood product use. But the remainder of recommendations from the US and the UK were not considered to be applicable, specifically because the settings we work in often don't have resources such as primary care services, preoperative assessment clinics, day surgery facilities, or critical care resources. However, there were also further concerns on pursuing a Choosing Wisely initiative in Africa, and the first were the lack of evidence on perioperative care and the lack of routine collection of accessible data to build recommendations on. And secondly, the lack of education and training, which would lead to unsuccessful implementation of any recommendations. But these factors supporting the pursuit of setting Choosing Wisely recommendations were that the community and collaboration amongst members are growing in Africa. And there were recent successes in projects that was developed in the community, including priority setting exercises. And the initiatives to generate evidence is still ongoing. Furthermore, the advocacy skills and the support that is growing within the community has great potential to influence policy making, which will also impact on implementation of recommendations. I thank you.